The Sexless Marriage as a Cause for Childlessness. Hi, I'm Dr. Malpani. I'm an IVF specialist, and today I'm going to be talking about sexual dysfunctions can cause childlessness. Now, you must remember there is a difference between infertility and childlessness. Childlessness means not having a child. Now, this could be because couples don't want to have a baby, they're choosing to be childless, or they have a medical problem as a result of which they can't get pregnant, and that's called infertile. Now, the definition of infertility is if you've been having sex regularly for 1 year and still fail to get pregnant. But there is a surprisingly large number of couples who are not being able to have sex. And this kind of sexless marriage, the technical word for which is unconsummated marriage, is a surprisingly common cause of not having a baby or childlessness, what appears to be infertility, but of course no one goes into the bedroom to see what's happening. So therefore we need to differentiate, but quite frankly it's a technical definition. As far as the couple is concerned, hey doc, we want a baby, we're not having a baby because we're not being able to have sex, can you help us? Now that might seem a little surprising. Can't have sex? Sex is such a basic biological urge. 16-year-old teenagers are having sex regularly in the back of the car, so why is it so difficult for adult couples to be able to have sex? And you'll be surprised. This could obviously happen either because the wife has a problem, the husband has a problem, or both have a problem. And let me explain. The commonest problem is usually with the husband, and this is again of two types. One is where he has erectile dysfunction, what's called impotence, as a result of which he's not able to get an erection, or he cannot sustain the erection, as a result of which he cannot put the penis inside the vagina. And if he can't put the penis in the vagina, he's obviously not going to be able to ejaculate inside the vagina. Some, and again, fairly large number, will not be able to consummate the marriage because of premature ejaculation, which means they get the erection, but they ejaculate so fast that they cannot enter the vagina, as a result of which they ejaculate outside. So both of these are male causes for the unconsummated marriage. And obviously, if the semen is not going in the vagina, the wife's not going to get pregnant. And sometimes the problem is not with the husband, the problem is with the wife. She has a condition called vaginismus, which is an involuntary spasm of the vaginal muscle. She's so scared that she keeps an eyes tied apart, and she just won't allow the husband to put the penis inside the vagina. The husband doesn't want to rape her. He's not cruel, he's not unkind, as a result of which he just cannot enter the vagina. Again, this is surprisingly common, especially in India, where there isn't enough sex education available for couples, and a lot of them are virgins when they get married, so they don't know what the truth is. It's either second-hand information or incorrect information or unreliable information, either from watching blue films or from friends or what have you. And this actually compounds the problem. And it becomes a matter of great shame and embarrassment, both for the husband and the wife. The husband, for example, if he has, let's say, premature ejaculation, is ashamed that he cannot control his erection and he ejaculates too fast. Often they don't even know the right word for this, and they're so embarrassed they don't know how to describe their problem or whom to describe the problem to. Do you go to your family doctor? Do you go to your gynecologist? How do you explain what's happening? No one wants to bring it up because it's the elephant in the room. So the wife doesn't want to hurt her husband's ego, so she can't say anything. The husband is ashamed, so he doesn't want to say anything, and the matter just prolongs itself. Now remember, these are happily married couples. They love each other, they snuggle and they cuddle, they just don't have sex. Now they will often masturbate each other, so they will at least get sexual release, but they're not able to fix the problem and they don't know what to do about it. And they wander from pillar to post, and they often don't give the right history, or the doctor doesn't even bother to ask them these questions, as a result of which the problem often doesn't get solved. The good news, of course, is it's a very solvable problem. So you should be happy. If you can fix your problem for yourself in your bedroom, isn't that much better? So again, there are multiple stages for how to fix this. And if you like, you can work backwards. You can say, hey doc, I'm in a hurry, I want a baby quickly. In which case, of course, the doctor can offer a medical intervention, which could be IVF. For example, if the woman is older or they're in a hurry to have a baby, fine, let's just forget about the sexual dysfunction. You want a baby, we'll take out the eggs, add the sperm, make an embryo, put in your uterus, you get pregnant. That's the most important thing. And a lot of couples are quite happy with that solution. Yes, we want to have a baby, we want to complete our family, we can always look after the sex problem afterwards. Fair enough. Of course, the problem with that is that once they have the baby, they never care to fix the sex problem, but really, that's their choice. You could also do simpler treatment options such as an artificial insemination, which the doctor can do. Or couples can actually do what is called a self-insemination, and you can buy the Malpani Baby self-insemination kit on our website. Or they can work on solving the sexual problem. Now, this is both good and bad because sexual problems are often psychological problems. So it's not easy enough just take a tablet and we'll fix it for you. Therefore, they obviously take much longer to resolve, and all these problems are never just the husband or the wife, it's always a couple's problem. So if you're willing to be patient and work through it, great. Because in that way you can have a baby in your own bedroom and you can resolve the underlying issue. But as I said, don't expect a quick fix. It's taken time for the problem to build up and it will take time for it to solve. The bottom line is solutions are available. What solution you want to explore is up to you. And if you'd like more information on the sexless marriage or the unconsummated marriage and how you can solve this problem or how doctors can help you solve this problem and help you to have a baby, please go to our website at www.drmalpani.com. We've got tons of information on this common distressing topic which you really can't talk to anyone about. Or you could send me an email. Again, there's a free second opinion form. Happy to reply, no strings attached. And we look forward to helping you to have a baby. And nothing will give me more joy as a doctor. And if I can do that, I'll consider myself blessed. Look forward to seeing you online at drmalpani.com and look forward to helping you to have a baby.